Welcome to ePathashala. I am Anita, faculty from School of Medical Sciences, University of Hyderabad. Dear students, today we will examine United Nations Health and Nutrition, the paper on population and health. The United Nations is an international organization founded in the year 1945. It is currently made up of 193 member states. The mission and work of the United Nations are guided by the purposes and principles contained in its founding charter. The United Nations system, also known unofficially as the UN family, is made up of the United Nations itself and many affiliated programs, funds, and specialized agencies, all with their own membership, leadership, and budget. The program and funds are financed through voluntary rather than assessed contributions. The specialized agencies are independent international organizations funded by both voluntary and assessed contributions. The United Nations, since its inception, has been actively involved in promoting and protecting good health worldwide. Leading that effort within the United Nations system is the World Health Organization, commonly referred to as WHO, whose constitution came into force on 7th April 1948, a date we now celebrate every year as World Health Day. At the outset, it was decided that World Health Organization's top priorities would be malaria, women's and children's health, tuberculosis, venereal disease, nutrition, and environmental pollution. Many of those remain on World Health Organization's agenda today, in addition to such relatively new diseases as HIV and AIDS, diabetes, cancer, emerging diseases such as SARS, which is severe acute respiratory syndrome, Ebola, and Zika virus. In 1948, World Health Organization took over the responsibility for the international classification of diseases, which has become the international standard for defining and reporting diseases and health conditions. Since its creation, World Health Organization has contributed to many historic achievements in global public health work. Some of them are antibiotics. The great era of discovery of present-day antibiotics begins in the year 1950, and the World Health Organization begins advising countries on their responsible use. Polio. In 1988, the Global Polio Eradication Initiative was started. It was established at a time when polio paralyzed more than 350,000 people a year. Since then, polio cases have decreased by more than 99% because of immunization against the disease worldwide. Smallpox. Following an ambitious 12-year global vaccination campaign led by the World Health Organization, smallpox is now eradicated. The last case was seen in 1979. Tuberculosis. The strategy for reducing the toll of tuberculosis was launched in the year 1995. At the end of 2013, more than 37 million lives had been saved through tuberculosis diagnosis and treatment under the strategy. AIDS, tuberculosis, and malaria. The Global Fund to fight against AIDS, tuberculosis, and malaria was initiated in the year 2001. A new partnership and funding mechanism, initially hosted by the World Health Organization, was created in collaboration with other United Nations agencies and other major donors. Children's mortality. The number of children who died before their 5th birthday declined below 10 million for the first time in recent history, as per the records of the year 2006. Heart disease, diabetes, and cancer. For the first time, World Health Organization member states set global targets to prevent and control heart disease, diabetes, cancer, chronic lung disease and other non-communicable disease. This initiative began in the year 2012. Ebola virus outbreak. The biggest outbreak of Ebola virus disease ever experienced in the world strikes West Africa in the year 2014. The World Health Organization Secretariat activates an unprecedented response to the outbreak, deploying thousands of experts, medical equipment, mobilizing foreign medical teams, and coordinating creation of mobile laboratories and treatment centers. In 2016, World Health Organization announces 0 cases of Ebola in West Africa, but warns that flare-ups of the disease are likely to continue and that countries in the region need to remain vigilant and prepared. World Health Organization staff, who include medical doctors, public health specialists, scientists, and epidemiologists and other experts, are at work on the ground in 150 countries worldwide. They advise ministries of health on technical issues and provide assistance on prevention, treatment, and care services throughout the health sector. United Nations Development Programme. The United Nations Development Programme exists since 1965. It is an executive committee within the UN General Assembly. The United Nations Development Programme head is the third highest office within the hierarchy of the United Nations, immediately after the UN Secretary General and his deputy. The United Nations Development Programme Executive Committee consists of representatives from 36 countries around the world, which are constituted on a rotating basis. With headquarters in New York, in USA, the United Nations Development Programme promotes the provision of advisory capacity, training, and grant funds. Here is an increasing focus on the promotion of the so-called least developed countries, LDCs, in order to achieve the Millennium Development Goals and advance the global development. UNDP focuses on poverty reduction, HIV/AIDS, democratic governance, energy and environment, as well as the general crisis prevention. UNICEF, founded in the year 1946 with the name United Nations International Children's Emergency Fund, since 1953 under the name United Nations Children's Fund, was initially founded to help children in Europe after the Second World War. Today, UNICEF works primarily in developing countries. The organization supports in approximately 190 countries the mother and children in the areas of health, family planning, hygiene, nutrition, as well as education, and provides humanitarian aid in emergencies. In addition, it operates on a political level, lobbying such as against the use of child soldiers or for the protection of refugees. Its headquarters is located in New York, in USA. Undernutrition or malnutrition is a common feature of developing countries, especially in the lower age groups of the population. It is generally recognized that in order of importance, protein-calorie malnutrition, avitaminosis A, anemia, and goiter are the most prevalent manifestations of these conditions. Better sanitation, improved education, and economic development, including an increased production of more nutritious food, will lead to the solution of the problem. However, it may be a long while before these objectives are reached, and in the meantime, some immediate measures must be taken to assist developing countries in the prevention of these conditions. The World Health Organization, the Food and Agriculture Organization of the United Nations, and the United Nations Children's Fund, UNICEF, are cooperating towards this objective. The principal objective of these organizations is to provide assistance to the member countries by helping them to identify their food and nutritional problems and to assist them in improving the nutritional situation. Nutrition and food surveys to determine the nature and importance of these problems are conducted with the assistance of consultants provided by the organizations. After recommendations have accordingly been made, the consultants may, in some cases, help the governments to implement them. Practical measures to be taken may include, among others, the setting up of nutrition units in the ministries of health, the establishments of coordinating bodies at the highest governmental level, the creation of nutrition institutes, the training of national personnel to be employed in nutrition projects, the elaboration of a food policy at the national level, and the promotion of a more effective system of production and distribution of food products. Evaluation of the results of surveys have been greatly facilitated by the establishment of guidelines drawn up by expert committees. Reports of these committees on the evaluation of nutrition status, on protein requirements, and on calcium requirements, to mention only the most recent ones, have been published by the organizations. The major activities of the three organizations in the field are as follows. Protein calorie malnutrition. Identification of protein malnutrition in infants, children, and women of childbearing age may lead to the development of several types of programs. Protein-rich food programs, the study and development of new sources of proteins and protein food. Mixture is being pursued jointly by the three organizations under the guidance of the Protein Advisory Group. The latter has been closely associated with the whole development of protein-rich foods, advising the organizations on their suitability, safety, and nutritive value, and proposing tentative guidelines for processing and quality check. Skim milk powder has been widely used in prevention of calorie-protein malnutrition. Nowadays, however, increasing quantities of protein-rich food mixtures based on soya, cottonseed, and peanut concentrates are used in the supplementary feeding of children of preschool or school age. Supplementary feeding programs. Milk powder for free distribution in public health centers, communities, and schools are provided to a number of countries. Milk conservation. Assistance has been provided to India for improved animal feeding in some areas servicing city milk plants. Applied nutrition programs. Applied nutrition programs are conceived as a coordinated educational activity of the Departments of Agriculture, Health and Education for the purpose of raising the nutritional level of local populations in rural areas. Good nutrition allows children to grow, develop, learn, play, participate, and contribute. UNICEF, World Health Organization, World Bank, global and regional child malnutrition estimates from 1990 to 2017 reveal that we are still far from a world without malnutrition. The joint estimates published in May 2017 cover indicators of stunting, wasting, severe wasting, and overweight among children under 5 years of age. Data reveals insufficient progress to reach the World Health Assembly targets set for the year 2025 and the Sustainable Development Goals set for 2030. United Nations milestones in regard to food and nutrition. In 1943, United Nations Conference on Food and Agriculture was held from 18th May to 3rd June in Hot Springs, Virginia in the United States of America with the participation of 44 governments. This was convened by US President Roosevelt. The conference decided on the establishment of a permanent organization in the field of food and agriculture. In 1945, Food and Agriculture Organization of the United Nations FAO was established. The first session of the FAO conference met in Quebec City, Canada, establishing the FAO as a specialized agency of the United Nations. In 1961, World Food Programme was established. World Food Programme was initially established in the year 1961 as a multilateral food aid program with the support of the United Nations General Assembly resolution. In 1974, First World Food Conference was held. The First World Food Conference was held in Rome on 5th to 16th November 1974, where governments examined the global problem of food production and consumption. In 1979, Plan of Action on World Food Security. The Food and Agriculture Organization Committee on World Food Security adopted the Plan of Action on World Food Security at its fourth session, Rome, between 5th and 11th April 1979. In 1981, World Food Day established. By adopting the General Assembly resolution, the United Nations welcomes the observance of World Food Day annually on the 16th of October. In 1992, First International Conference on Nutrition, World Declaration and Plan of Action for Nutrition. In December 1992, the Food and Agriculture Organization and the World Health Organization organized the first International Conference on Nutrition in Rome, Italy. 1996, World Food Summit, Rome Declaration on World Food Security and World Food Summit Plan of Action. World leaders assembled in Rome in November 1996 for the World Food Summit. The Food and Agriculture Organization called the summit in response to widespread undernutrition and sought to renew the global commitment to fight against hunger. 2000, the United Nations Millennium Declaration. The declaration was a new global partnership to reduce extreme poverty and hunger and came to be known as the Millennium Development Goal. Goal 1 was to include commitment to halve the proportion of people who suffer from hunger by 2015. 2002, World Food Summit +5. The World Food Summit 5 years later, held between 10th and 13th June 2002, reaffirmed pledges to end hunger. The outcome document is Declaration of World Food Summit 5 years later. In 2008, United Nations Secretary General High-Level Task Force on Global Food and Nutrition Security. The High-Level Task Force on Global Food and Nutrition Security was established by United Nations Secretary General Ban Ki-moon in 2008. The task force is chaired by the United Nations Secretary General and the FAO Director General is the Vice Chair. 2009, Rome Declaration on World Food Security. World leaders unanimously adopted a declaration pledging renewed commitment to eradicate hunger from the face of the earth during the World Summit on Food Security. 2012, Rio +20, Zero Hunger Challenge. The Zero Hunger Challenge, an initiative by the United Nations Secretary General, invites all countries to work for a future where every individual has access to adequate nutrition and resilient food systems. 2012, Food Assistance Convention. The Food Assistance Convention, an international treaty, was adopted on 25th April 2012 in London. The treaty aims at addressing the food and nutritional needs of the most vulnerable populations. 2014, Second International Conference on Nutrition. The Second International Conference on Nutrition was held in Rome, Italy in November 2014 and adopted the Rome Declaration on Nutrition, committing countries to eradicate hunger and prevent all forms of malnutrition worldwide. 2015 Milan Declaration on Enhancing Food Security and Climate Adaptation in Small Island Developing States. The meeting addressed food security and nutrition from multiple angles: the importance of promoting sustainable approaches to agriculture and fisheries and building resilience to climate change and disasters, the benefits of improving rural livelihoods of smallholders and family farmers. In 2015, United Nations Sustainable Development Summit. Goal 2. The United Nations Summit for the Adoption of the Post-2015 Development Agenda, a high-level plenary meeting of the General Assembly was held from 25th to 27th September 2015 in New York. Sustainable Development Goal 2 aims to end hunger and all forms of malnutrition by the year 2030. 2016 High-Level Side Event on Pathways to Zero Hunger. During the high-level side event to the 71st UN General Assembly, conversations about achieving zero hunger and the Sustainable Development Goals by 2030 were held. UN AIDS Strategy 2016 to 2021. At its 37th meeting, the UN AIDS Program Coordinating Board adopted a new strategy to end the AIDS epidemic as a public health threat by 2030. The UN AIDS 2016 to 2021 strategy is one of the first in the United Nations system to be aligned to the Sustainable Development Goals, which set the framework for global development policy over the next 15 years, including ending the AIDS epidemic by 2030. Download the UN AIDS 2016-21 strategy. 15 by 15, a global target achieved. Just as we have new opportunities that only a few years ago would have been inconceivable, we also now face new challenges. If the 15 by 15 success story has taught us anything, it is that we have in our hands the power to make the world healthier, more just and more equitable. We hope that this report not only reminds us of our power to change the world when we remain united, but also inspires us to take the actions needed to end the AIDS epidemic as a public health threat. The United Nations Millennium Development Goals. The 8 Millennium Development Goals, MDGs, which range from halving extreme poverty rates to halting the spread of HIV/AIDS and providing universal primary education, all by the target date of 2015, form a blueprint agreed to by all the world's countries and all the world's leading development institutions. They have galvanized unprecedented efforts to meet the needs of the world's poorest. The United Nations is also working with governments, civil society, and other partners to build on the momentum generated by the Millennium Development Goals and carry on with an ambitious post-2015 development agenda. The following are the Millennium Development Goals. MDG 1. Eradicate extreme poverty and hunger. MDG 3. Promote gender equality and empower women. MDG 4. Reduce child mortality. MDG 5. Improve maternal health. MDG 6. Combat HIV/AIDS, malaria and other diseases. MDG 7. Ensure environmental sustainability. MDG 8. Develop a global partnership for development. Sustainable Development Goals. 17 goals to transform our world. Governments, businesses and civil society together with the United Nations have started to mobilize efforts to achieve the Sustainable Development Agenda by the year 2030. Universal, inclusive and indivisible, the agenda calls for action by all countries to improve the lives of people everywhere. In 2015, countries adopted the 2030 Agenda for Sustainable Development and its 17 Sustainable Development Goals. In 2016, the Paris Agreement on Climate Change entered into force, addressing the need to limit the rise of global temperatures. Explore this site to find out more about the efforts of the United Nations and its partners to build a better world with no one left behind. The following are the Sustainable Development Goals. Goal 1. End poverty in all its forms everywhere. Goal 2. End hunger, achieve food security, and improve nutrition and promote sustainable agriculture. Goal 3. Ensure healthy lives and promote well-being for all at all ages. Goal 4. Ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Goal 5. Achieve gender equality and empower all women and girls. Goal 6. Ensure availability and sustainable management of water and sanitation for all. Goal 7. Ensure access to affordable, reliable, sustainable and modern energy for all. Goal 8. Promote sustained, inclusive and sustainable economic growth, full and productive employment and decent work for all. Goal 9. Build resilient infrastructure, promote inclusive and sustainable industrialization and foster innovation. Goal 10. Reduce inequality within and among countries. Goal 11. Make cities and human settlements inclusive, safe, resilient and sustainable. Goal 12. Ensure sustainable consumption and production patterns. Goal 13. Take urgent action to combat climate change and its impacts. Goal 14. Conserve and sustainably use the oceans, seas and marine resources for sustainable development. Goal 15. Protect, restore and promote sustainable use of terrestrial ecosystems, sustainably manage forests, combat deforestation and halt the reverse land degradation and halt biodiversity loss. Goal 16. Promote peaceful and inclusive societies for sustainable development, provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. Goal 17. Strengthen the means of implementation and revitalize the global partnership for sustainable development. Human resources development is fundamental to the development process, contributing to poverty eradication and long-term economic growth through improved health, education, and human capacity building. The centrality of this is clearly reflected in the outcomes of the Global United Nations conferences of the past decade and in the Millennium Declaration adopted by all heads of state or government at the Millennium Summit. To foster progress in this regard, health and education policies, their complementarities, and the relations of these with policies in other sectors have to be used to maximum advantage in order to mobilize synergy and leverage. Ensuring the full integration of health and education into poverty eradication strategies is essential, as is the role of the international community and of the United Nations in assisting developing countries to build relevant capacities. In the year 2000, world leaders gathered at the United Nations and adopted the Millennium Declaration, which contains a set of key goals to achieve a more peaceful, prosperous, and just world. The world community thus committed itself at the highest level to reduce by half the proportion of people living in extreme poverty, achieving universal primary education, reducing child mortality, and combating the spread of HIV, AIDS, malaria and other diseases by the year 2015. Human development, including in the areas of health and education, was thus placed at the center of the United Nations Development Agenda. The implementation of this ambitious agenda requires further work and the building of true partnership between member states, United Nations system and civil society. The United Nations now faces a challenge of how to involve in its work all the key actors who can make a difference at the grassroots level. The contributions of the United Nations programs, funds and agencies as well as civil society representatives were crucial to ensure the successful outcome of the debates and the adoption of a strong ministerial declaration which underlines the centrality of human resources development to poverty eradication and sustainable development, and which gives concrete content to the policies and means required to implement the Millennium Development Goals in the areas of health and education. The United Nations contribution for improving nutrition and health status of people all over the world. The United Nations help for the welfare of the people so that nations will develop successfully. Thank you.